Welcome to today's podcast episode. I am Ramesh Arunachalam. Today we have a special guest with us, Dr. Akshay Ari, a renowned neuro and spine surgeon practicing in Bangalore for more than 14 years, and he is expertise in minimally invasive surgeries and scoliosis treatment.
Thank you, Ramesh. It's a pleasure as well. Hello, everyone. I am Dr. Akshay Hari, and I'm going to talk to you about adolescent idiopathic scoliosis.
Thank you, doctor. For the benefit of the parents and the common public, could you please explain me what is mean by adolescent idiopathic scoliosis?
Correct. So there are various types of scoliosis. Actually, scoliosis is a very common condition in the general public. Almost 5 to 7% are usually affected by scoliosis, but not all the scoliosis are the same. There are various types. Sometimes it is called congenital scoliosis, where the children are born with the scoliosis. The adolescent idiopathic scoliosis is the most common type. Usually 70% of all scoliosis comes under this category. Then there is also adult scoliosis and various other neurological conditions which cause scoliosis. This is known as neuromuscular scoliosis. So these are the broad categories of scoliosis in general. Coming to adolescent idiopathic scoliosis, like I already mentioned, it forms almost 70% of all types of scoliosis, and more importantly, this is the scoliosis which affects children. And during their growing spurt, especially during puberty and when the child grows, these are the kind of scoliosis that can progress over time. So now we have been talking about scoliosis. First, let me just tell you what exactly is scoliosis. Normally, when we see the people from the behind or from the front, the spine should be straight. It should be like this, right?
Yes.
So sometimes there can be an abnormal bend in the shape of the spine. That can be either a C shape or an S shape. So that is called as scoliosis.
While you are talking, you have mentioned about the percentage prevalence of adolescent idiopathic scoliosis is more globally. What is the current prevalence in India?
So whatever the statistics we have are actually only for the global population. In India, there are unfortunately no major statistics which have proven. Roughly, we can say that it is affecting about 3 to 4% of all children who are affected by scoliosis. And the reason for this is that in India, the awareness among the public or among the doctors or among the medical field in general is not so much, so that the scoliosis is not given so much importance. So that is probably one of the main reasons why the exact prevalence in India is not known.
So do you think it is more as compared to the other global data?
It is more or less, I would say, compared to the Indian population. So I would say roughly we expect it to be the same as the world population. But yes, there is a huge chunk of the population which is probably undiagnosed. And there are various reasons for this. One of the most common reasons is because many people think that scoliosis is something that we should not be talked about, or it's a taboo, or something like deformity in the children is something that should not be, it's like a stigma. So many people may not come vocal about it or may not even actually come to the doctor unless it is in the late stage. And another important thing is that the adolescent idiopathic scoliosis affects girls more than the boys. Roughly about 7 times it affects the girls more than the boys. The exact reason, well, like the name itself mentions, adolescent idiopathic scoliosis means the exact reason nobody knows. We don't know why it happens or how it happens or with whom it happens. We just know the facts. The facts that yes, it does affect children. And these are the statistics. Roughly about 3 to 4% of all children can have scoliosis at some point. And it is usually there in girls more than the boys, and it usually progresses as they grow, especially during the growth spurt. This is why we should actually detect it early, and the awareness should be there that such a condition can affect children, and that if it is detected early, it can be treated appropriately as well.
What should we do for the diagnosis in the early stage?
So there are various reasons. The most simple reason why somebody will notice is that the parents usually notice that there may be an abnormal bend in the spine. Sometimes when they are seeing the children from the back, they may be noticing that one shoulder is slightly higher than the other shoulder. Sometimes there may be ribs which are slightly more prominent. Sometimes the body of the child may be slightly rotated. Sometimes there may be the waist, there may be abnormality or there may be an unevenness in the waist. So these are the most common ways parents may actually detect it. But there are of course more formal ways of detecting. If at all there is a suspicion of something abnormal in the spine, sometimes even when they touch the child's back, they may find that the shape of the spine is not straight, there may be some bend. Even when the child is sitting straight, not just that the child is sitting in a bent posture. So there may be, these are the ways that it can be detected, but some of the more formal ways that it can actually be detected is when they make the child to actually bend, and then they see that one of the shoulder, one of the ribs are slightly slightly higher than the other. This is known as something what we call in medical terms as the Adams forward bending test.
Doctor, you said about the prevalence in India. I hope it is not alarming situation in India right now.
Well, actually, to tell you the truth, what I have mentioned is probably only the tip of the iceberg, because there is a huge population which is really undiagnosed or underdiagnosed in India. The real prevalence may actually be much higher. The fact is that many patients come to the doctors only in the late stage, when there is a very bad deformity or when really some complications have happened, and it is really missed in the earlier stages. If it can be detected in the earlier stages, the treatment options that we can give can also be much better, and the outcomes and the prognosis of this entire scoliosis can also be much better actually.
So what is the real challenge?
So like I mentioned, the real challenge actually for us doctors or as spine specialists who are treating scoliosis is the fact that, like I've already mentioned, people come to us only in the late stage. See, scoliosis, there are various types of scoliosis. It ranges from mild, it ranges from moderate, sometimes severe scoliosis. So there is actually a classification called as the SRS classification. In that, the categories of scoliosis are actually mentioned. Any curves which are less than 10 to 20 degrees are known as mild scoliosis. In such cases, no treatment is required. Sometimes just observation may be necessary, because these are the curves which may not progress also. The curves which are between 20 to 40 degrees, these are moderate scoliosis. Now these are the scoliosis we have to very carefully watch out for, because they can progress. And if it progresses, there may be requiring some more invasive treatment like surgery. These moderate cases, these are the ones which can be treated effectively with simple methods like physiotherapy, sometimes even with other methods called bracing. We can talk about it later. But the severe scoliosis, which are more than 40 degrees, 50 degrees, these are the ones which will require surgery. Even then, once it is detected early, sometimes the surgical treatments are more effective rather than these cases if it is progressed and the curves are becoming very complex and more very significant deformities, then even surgery becomes complicated.
You said people are coming at the late stage. How the parents or the teachers in the school to find out the mild one?
So parents can, like I've already mentioned, parents can notice these kind of milder cases by just simply observing the child from behind. In Western countries, there are some camps which are conducted, scoliosis screening camps which are conducted at the school level. Such similar kind of methods can be employed even in India to detect these kind of scoliosis, early scoliosis in the school-going children itself.
If it is not treated at the early stage, what will be the complications the children are going to face?
The scoliosis, especially adolescent idiopathic scoliosis, we must all remember it will progress no matter what. So the earlier it is detected, the better treatment options we can do. In case it goes undetected, or in case that the scoliosis progresses and if it is not treated, there can be some severe complications, especially because of the deformity. If the large curves are there can be deformity not only of the spine but also of the ribs and the rib cage. So the structures inside, like for example, there can be complications to the lungs, there can be complications to the heart, there can be breathing difficulties. Sometimes there can be even neurological complications in extreme severe complicated cases of scoliosis.
What do you mean to say that if it is not treated at the early stage, it leads to severe complications?
Yes.
Maybe it hampers their day-to-day activities also.
Correct. Absolutely. Sometimes they can even have pain in very severe complex. Usually the simple or the adolescent idiopathic scoliosis will not have much of pain. So unlike various other conditions where pain is the first symptom, here there may not be much of pain except for a deformity. But only in severe cases, sometimes there can be pain because of the abnormal posture of bad scoliosis.
Is there any particular age is there the deformity starts progressing?
So yeah, like I already mentioned, the puberty is usually the time when the growth spurt occurs. So it is during this time that progression can happen rapidly. Progression will happen throughout the teenage age group, that is right from 10 years all the way up to 18 years progression can happen. In fact, progression can happen even after that. But the rate of progression usually is maximum during the growth spurt of the child, which varies from child to child but is roughly around 9 to 12 years in the girls and roughly around 10 to 14 years in boys. So one more point I would like to make it is at any point, like whatever we mentioned, these signs and symptoms, if the children detect or if the parents detect or if the school teachers or whoever is giving the care to the child, they detect this kind of signs in the child, it is very important to show to a consultant or to a spine specialist who can then guide them accordingly.
I have one small doubt. Because in our scenario, we are not giving much importance for the postures. Even sometimes children are sitting in a different postures nowadays. So you know that people are using a lot of gadgets and they are sitting in a different postures. They are not bothered about that. And any particular important symptoms do you like to notice immediately to address this adolescent idiopathic scoliosis?
So that is actually a myth. So the posture or the bad posture or sitting in abnormal posture usually does not contribute to the scoliosis. So in fact, the scoliosis can be one of the reasons for the bad posture, but not vice versa. In fact, there are other myths also. Many parents may think that carrying the heavy school bags or carrying it on one shoulder or being in a very bad position, that may increase the scoliosis or worsen it. But actually that is not the case. Usually it is genetic and it may happen to anybody. So it is not really because of these misconceptions.
If we put a heavy bag, especially how to wear the school bags and all they are telling, is there related to lead to scoliosis?
Not really. It may not it is not directly responsible for in the setting of scoliosis. It is just an overall general spine health that we say. It can cause a bad posture, can affect the spine in various other ways. There can be pain, there can be musculoskeletal problems because of that abnormal posture. So it is always important to maintain a good posture. But in the setting of scoliosis, it is not really responsible for either the progression or the development of scoliosis.
What is the treatment options currently available at the different stages?
Correct. So that's a very good important topic because it is not just important to detect scoliosis early, it is also important to treat the scoliosis once it is detected earlier. So like I already mentioned, there are various types of scoliosis. It can range from mild, moderate and severe. So the first category is the mild scoliosis. Sometimes between the scoliosis is actually any curve which is more than 10 degrees. So less than 10 degrees is considered normal. Anybody may have a little bit variation, but up to 10 degrees is considered normal. 10 to 20 degrees is considered mild. Now these curves usually can just be observed. There is no other treatment that is required. Observation can be in the form of serial follow-ups with the doctor. Usually doctor consults are roughly about 3 to 6 months. During this time we will usually do x-rays and at that time we will detect whether there is any progression or not. And also sometimes we advise simple things like postural corrections, sometimes simple exercises which they can do to prevent the progression. That is for mild curves. Now coming to moderate curves, that is between 20 to 40 degrees. These are the curves which have a tendency to progress faster or more than the milder ones. So these conditions usually while surgery may not be indicated, there is also a concept called as bracing. Now bracing is something where an external brace is actually physically applied to correct the bent shape in the curve, because usually these moderate curves are relatively flexible. So if we can straighten this curve by applying an external force in various methods, there are various types of braces which are there nowadays, which we in India is also coming up. So if a brace can be applied, then the concept, the theory is that the spine can grow in that particular way. But unfortunately in India being a tropical country and sometimes very hot climates are there, these braces cannot be worn for a long period of time. And the most important concept of wearing the brace is that it has to be worn for a particular duration, which is roughly ranging between 18 to 22 hours in a day. So maybe about 2 to 4 hours the child can take it out, but remaining time it has to be worn. So the compliance is very, very important, and the longer the brace is worn, the better the chances of prevention of scoliosis progression.
Doctor, while you are talking about bracing, whether it will correct the deformity?
So that's also a very good question actually. So the concept of brace is that I already told you it has to be worn. The compliance is very important. The longer it is worn, the better. So the theory is that it should be worn until skeletal maturity. That means until the child has completed the growth phase. So it has to be worn until that time. So during this time, the very good question is that does it truly correct? No, the brace cannot completely correct the scoliosis. It is just to prevent the progression. For example, if somebody has got a 30-degree curve, it will not make the 30 degree to 0 degree. While the 30 degree can be maintained or it can be reduced, it may be 5 or 10 degrees. The moment you remove the brace after skeletal maturity, the curve at what it was, if it was 30 degree, it will remain 30 degree. It will never be back less than what it was. The whole idea is that it will not progress to 40 or 50 degrees, wherein it may require surgery at that point of time. That is the whole idea of wearing the brace. Despite that, still sometimes the effectiveness of brace is not truly there in all the patients, and sometimes patients may progress despite wearing the brace as well.
So you mean to say that we should wear the brace continuously 18 to 20 hours? Maybe in our situation,
yes, so that is
really a challenging one.
That is the truth. So that is the biggest challenge of bracing in India. So that because here we have to wear, and the compliance and the patients also have to wear it for a very long time, and it has to be worn for many years at a stretch. So invariably children do tend to progress, or the scoliosis do tend to progress despite wearing the brace. It is not just in India, this problem exists across the world.
Doctor, if we are using a brace behind what you said, that angle more than a 40 degree, whether it is really helpful for the patients who are having a more.
That's also a good question. So like I said, this brace can help only in those curves which are flexible and which are moderate, not in the severe curves, or not in the curves which are more than 40-50 degrees, because such cases will progress even more, and the ability of the brace to correct the scoliosis, like I mentioned, is only about 5 or 10 degrees, and it cannot. So something which is already more than 40 degrees, it will still progress after you remove the brace. It will still be 40 degrees, and sometimes it may progress after that as well. So in such cases, bracing is not an effective option. In such cases, the only definitive correction that can be achieved for a scoliosis which is progressed is only surgery, because only in surgery we can correct the scoliosis back to a reasonable normal curve.
As a parent, first of all, I am really worried about to go for a surgery in a spine especially.
Yeah,
what is your opinion?
So that's a very good question actually. Many people have the fear of surgery. Yes, there are risks and complications associated with any surgery, but nowadays spine surgery can be safe. With recent advancements in technology, with recent advancements in technique as well, this scoliosis surgery also can be performed reasonably safely. There are things like intraoperative neuromonitoring, wherein we are actually monitoring the nerves while the surgery is being conducted, so that we know whether the nerves are working in the way they are supposed to work or not. This helps us to improve the safety of the surgery. Also, nowadays we have better neuroimaging methods, as well as things like navigation, where they know where we are placing the screw, so that the surgery can be performed in a much better way and improved outcomes to the patient.
Surgery is safe also, but to avoid the surgery, what is your opinion?
So like I said, surgery might be necessary in some cases, but these cases are only the tip of the iceberg. So roughly there are statistics which say that not all scoliosis progress. Maybe only about 1% of the scoliosis actually progresses to require surgery. Most of the other types of scoliosis can be managed without surgery in conservative methods itself. So like I mentioned, a combination of all these things, whatever we have spoken so far, things like bracing, observation, serial follow-ups with the doctor, that is also very important. At least once in 6 months, we should have a serial follow-up, so that repeat x-rays can be done and we can monitor the progression of the curves. During this time, the child can also perform certain lifestyle changes, modifications, certain exercises to keep or to maintain the flexibility of the spine. Even physiotherapy, yoga, these are all things which can be tried. Now, none of these methods are going to work in isolation. Everything requires a combination. So while performing physiotherapy or yoga will not prevent the progression of scoliosis, it can prevent pain, or it can prevent the complications, and it can help maintain the flexibility of the spine.
Doctor, what is the message you would like to give it to the parents?
And I think the most important message I would like to tell, especially to the parents and especially even to the patients who are all suffering with scoliosis, is that number one, early detection. So we should definitely, at any stage, if these signs and symptoms of scoliosis are noticed or any bent spine is noticed in the child, the parent should first come to the spine specialist, and they should at least bring it to the attention so that they can early treatment can be initiated accordingly.
And as a common public, what is the responsibility of the other social.
So, like I said, this scoliosis, it is not just important to know about scoliosis or it is to detect early. How do we do it? It is only by improving or increasing the awareness of this. And I think that is the most important responsibility of our entire society as a whole. Whether it is the doctor community or whether it is these kind of support groups which are there, communities must be there to improve the awareness among the general public. Only when the public is aware of a condition such as scoliosis and what are the complications of not detecting it early and what are the potential disadvantages, especially in the late stages of having the scoliosis, and what are the advantages of treating it early, only then we can completely control this condition, or only then we can say we have conquered scoliosis as a whole.
So to summarize with that, doctor, your suggestions to all the viewers?
Yes. So to everybody, I would just like to say three things. Number one, don't be afraid. There is no need to fear scoliosis. Number two, let us fight this social stigma. Number three, let us all conquer scoliosis together. Thank you.
Thank you very much to everyone for watching this wonderful session on adolescent idiopathic scoliosis.